Thank you, and good afternoon, everybody. I'm going to speak about how to reduce your risk of lung cancer. So, where do we stand with lung cancer at the moment in Ireland? Lung cancer is not our most common cancer, but it is one of our most common cancers. It is the third most common cancer in males in Ireland and the second most common cancer in females in Ireland. And while it is not our most common cancer, it is our most common cause of cancer death. Currently, we have about 2,700 cases of lung cancer every year in this country. To think about how to reduce our risk of lung cancer, we need to think about the risk factors for lung cancer, the things that can increase our risk of developing this cancer. Risk factors can be broadly divided into non-modifiable things, that's things you cannot change, and modifiable things, that's things we can change. Non-modifiable risk factors, the things we cannot change, can include our age. We can't control the fact that we're getting older, our family history, a diagnosis of smoker's lung disease, being a smoker in the past. Being a passive smoker isn't something we can always control, and we can't always control our environment and our exposure to radiation. Modifiable risk factors, the things we can change, include smoking and radon. To begin with radon, radon is a gas that occurs naturally in our environment. It's produced by soil and stones, and it's all around us, and this is not avoidable. Exposure to radon over a long period of time can increase our risk of lung cancer. In fact, in Ireland, about 350 cases of lung cancer, that's 13% of all cases every year, are caused by radon. The risk from radon is far greater for smokers than for non-smokers. Smokers are more susceptible to radon. However, although radon in the environment is outside of our control, we can address and modify the radon in our home. And for more information about this, you can log on to the Environmental Protection Agency website, www.epa.ie. Smoking is the biggest modifiable risk factor for lung cancer. Smoking causes about 80% of all lung cancers. Even if you don't smoke, passive smoking increases your risk. A smoker only inhales about 15% of the smoke from a cigarette. The other 85% goes into the air around them or is inhaled by others. Opening a window isn't sufficient. When you smoke, that won't make a difference. More than 80% of the smoke around you is invisible. You can't see it or see where it goes or control it. The best thing to do is not to start smoking, or if you do smoke, quit. And where do we stand in regard to smoking in Ireland at the moment? Well, we have seen a reduction in the numbers of people smoking in this country over recent years. It's reduced from 23% in 2015 to as low as 17% in 2019. However, in recent years, unfortunately, smoking levels have stalled at about 18%, so about 1 in 5 people in this country smoke at the moment. And it's not just the risk of lung cancer. Smoking has an impact on so many areas of our lives. Just shy of 1,000 people per week will be hospitalised as a result of smoking, and a little under 100 people a week will die as a result of smoking. And that's not to even mention the cost to the health service and other problems caused by cigarette smoking. The good news is that people who smoke want to quit. About 2 in 3 people who smoke want to stop, and indeed 1 in 2 people who smoke have tried to stop. The problem is that too many people go it alone and they try to quit without getting any help. And there's loads of help out there. This is a list of some of the supports that the HSE provides to smokers to help them quit. And you should be able to find one that suits you and that can be tailored to your needs and will work best for you. If you want to quit, if you're curious and if you think you could do with help, I'd suggest you start by logging onto the Quit website. Log on to www.quit.ie, put it into your search engine. That will bring you to this page where you can click on Stop Smoking Clinics. If you click on Stop Smoking Services, it asks you to select a service area. This is a geographic location for smoking services, and obviously you should select an area that is close to where you work or where you live and that's convenient to you. In this case, we clicked on Limerick, and you can see there are 9 places around Limerick that offer smoking cessation services. You can see 2 of them pictured here, and you can also see that the names, the emails, and the phone numbers of the people who run these services are here. I phoned one of them recently, and I'm very glad to say that they did phone back. I did speak to a human, and they were very helpful and informative and enthusiastic. They can offer you smoking cessation counselling courses, and they can also offer you nicotine replacement therapy. All of this is free of charge thanks to the HSE. This is what your smoking cessation course might look like. So you're looking at about a 6-week course, and they also follow you up at 12 weeks, at 24 weeks, and 56 weeks after you quit. In addition to the supports they give you, be it individual or group counselling, telephone support, text message support, internet-based support, they also offer stop smoking medication. And this could be in the form of medicines or nicotine replacement therapy. That would be your gum, patches, or inhalers. And all of this is free from the HSE, even if you don't have a medical card. So there's really no reason not to make contact. Not every lung cancer can be prevented, and if you do develop cancer, you do need to know what signs and symptoms you're looking out for. It's very important that you know the signs of lung cancer and you contact your GP as quickly as possible. Treatment options are better, and survival is so much better if you can find cancer early. You're watching out for a new cough, a cough that could last more than 3 weeks, or for a change in your usual cough, or breathlessness more than is normal for you. Watch out for coughing up blood, for unexplained chest pain or shoulder pain, for chest infections that keep coming back despite treatment. And then there are some symptoms that you might not particularly associate with lung cancer, such as loss of appetite, feeling extremely tired in a way that's unexplained or unusual for you, or for weight loss that's unexplained or unexpected. And really, any symptoms that are unexplained or unusual for you merit getting checked. What happens next if you do have symptoms and if there's concern for lung cancer? Ireland has 8 rapid access lung clinics dotted around the country. Your GP can send an electronic referral to one of these clinics. They'll receive that immediately, and if they are concerned for lung cancer, you can expect to be seen in a few weeks. So what do you need? Overall, cancer survival in Ireland is improving. There are now over 200,000 people in Ireland living with a cancer diagnosis, and that's a 50% increase in the number of cancer survivors compared with 1 decade ago. Indeed, between 1994 to 98 and 2014 to 2018, lung cancer survival has increased by 15 percentage points. So what do you need to do today? If you are a smoker, try to quit, and please seek help, and I'd urge you to contact quit.ie. If you have symptoms, don't be scared, don't delay, contact your GP today. And finally, for anyone who wants to see that list of symptoms again, or who would like to have a copy of that list of symptoms, you can find it on our website at hse.ie/cancer prevention. And there are many other cancer resources available on healthpromotion.ie. Thank you.